Hey everyone, I figured I would jump on here and do an updated video from my recent hospital trip. So yesterday I got up, I felt okay. I've had this pain, and I did mention this to the nurse practitioner the other day at my 1-month appointment. In my right upper quadrant, where like your liver, your gallbladder are, I've had kind of like a dull ache in that area, and the only way I can describe it is it feels like my liver is bruised. So when I talked to the nurse practitioner, she said it probably is bruised. They do a lot of like maneuvering, and they have a liver retractor in there, and they're pulling it back, and sometimes it causes some inflammation, and that can cause pain for a couple months. So I felt better about that. So yesterday I got up, I was feeling okay, other than that little like dull pain, which I've had. So nothing new. I had something to eat, so every morning I come downstairs and I take my pills crushed in a Greek yogurt. So I had that, got my kids ready, got them off to school, and then probably around 10:30 or so, I had an English muffin. Not the best choice, but I had an English muffin. I had one last week, and it went down okay. There was no issues. I ate it really slow, and I ate it yesterday very slow, no pain. And then probably about 40 minutes after I ate it, I got this excruciating pain, and it was in my right upper quadrant, where my liver, my gallbladder, all that is, and I got really scared. So I tried to tough it out. After about 40 minutes, when the pain wouldn't go away, it was kind of getting worse, I thought I need to go to the hospital. Now, when I was discharged from Hotel Dieu with Dr. Zevin, he told me, like, you don't live in Kingston, so go to your nearest hospital, and if there was something that they thought Kingston needed to see, they would just transfer me there. So I went to the Brockville Hospital, and I presented my little card that they give you after you have gastric bypass surgery. Let me show you. So after you have gastric bypass surgery, they give you one of these little cards to take around with you. So it says that you had Roux-en-Y, the date, and it is kind of helpful for the doctors that are looking after you, because it has all of these things here about the gastric bypass surgery, things to avoid. I don't know if you can read that, but it's a little card that they give you. Some of the main things that they have here are post-surgery emergency presentation of bariatric patients, a fever greater than 38.3, hypotension, so low blood pressure, tachycardia, so if your heart rate's over 100 for more than 4 hours, decreased urine output, bright red blood by mouth or rectum, abdominal pain, nausea, vomiting more than 4 hours, and then it goes on with what are some of the complications that could happen. This is really good to carry around with you, because it does go over like the anatomy of like what the surgery was, and it does say principles to guide management of bariatric emergencies, diagnosed within 6 hours, and to the OR within 12 to 24 hours if there was an emergency. And you put your clinic and your doctor's name on here so that if they had any questions, they could call. So it's also good to take with you because it says these are not typical abdominal surgery patients. They do not exhibit expected or typical signs and symptoms and have no physiological reserve to deal with complications. So one of the things it says here is NG tubes. So avoid blind NG tube placement. So sometimes a nurse or a doctor will go in and put in a nasogastric tube and they could rupture your pouch. And avoid aspirin, Plavix, steroids, and NSAIDs. And about the IV fluids, what you can and cannot have. So when I first presented to the triage, I told her what had happened. I had started having really bad abdominal pain, and she asked me if I had taken Tylenol and Advil. So I had handed her both my health card and this little card that I was told to carry around with me, and I told her I had taken Tylenol but no Advil because I cannot have Advil, and she didn't really seem to know much about bariatric surgery, so I did tell her to put it on my chart that it was an allergy, so that if something ever happened, I came in unconscious or something, that they would not try to give it to me unless it was life or death, you know. Please don't give me an NSAID. So she looked through the card and she put me in as a priority because of the complications with gastric bypass surgery. So I went into the waiting room and I was waiting and waiting. As soon as they took one person out, I was the first one to get called in. They did some blood work, and the doctor, I was concerned about my gallbladder. The doctor was concerned about maybe possibly having a stitch or something internally open up. So that scared me. So he wanted to do a CAT scan, which was fine, and blood work. So the pain was about a 10 out of 10 when I first got there. So they came in, they did an IV, they did some blood work, and they gave me a dose of hydromorphone, and that helped the pain tremendously. I was waiting and waiting and waiting, probably about 3 hours, and I still hadn't heard anything, and the lab tech comes in and goes, "Oh, I need to take some blood work," and I'm like, oh, like they just took some. And so apparently the nurse who took it didn't shake it around a little bit before she sent it down, so it was congealed, so they had to redo the blood work. So I got poked again. They did my blood work and they said it came back okay. My liver enzymes were slightly elevated, so that had me a little concerned. I had to go down for my CAT scan, and it was with contrast, and I've never had contrast before that I know of. Maybe they did it while I was in surgery with the leak test, I don't know. But they gave me this big sheet to fill out, to sign about, you know, the dangers of it, and you need to drink a lot more water to flush it out over the next 48 hours, and I got scared. So I have a panic disorder, and taking new pills, new whatever, scares me. So I was already a little panicked about this. So I go in, and the tech is talking to me, and I'm kind of freaking out. They put me on the table to go into the CAT scan machine and told me to hold my arms up, and they started sliding me in, and it was up to like about here on me, and I started panicking. And he's like, okay, we're gonna put some dye through here and it's gonna probably feel like you're peeing your pants. And I was like, I can't do this, I can't do this, get me out of here, get me out of here. I just started freaking out. He's like, if you can hold still for like another minute, we can get all the pictures that we need without the contrast. So I did. I tried to stay as still as I could so that they could get the pictures that they needed. So the doctor came back in and said everything surgery-wise looks really good. They didn't mention anything about my gallbladder, which is kind of what I thought might be going on. So they sent me home and told me to take Tylenol and use heat for the pain to that area. So this morning I called the bariatric clinic just to let them know what was going on. So I talked to the nurse practitioner and I told her about what had happened, and she asked if they did an ultrasound, and I said no, but I did tell her that I was still having some abdominal pain. It's dull, but it is still there. So I did tell her about that, and she thought it would be a good idea that we do a ultrasound. So she's sending me for an ultrasound. She sent a requisition to have that done as soon as possible. So I'm hoping that within the next week or so I get a call to get that looked at. And if I have any more abdominal pain, I'm gonna go straight to Kingston because they are the ones who did my surgery, and yeah, so they didn't really give me any answers, so I'm hoping that I get some answers from this ultrasound. Also, I did mention to her that my liver enzymes were elevated, and she put my mind at ease by telling me that it's not uncommon for people after surgery to have elevated liver enzymes because they put in the liver retractor and move it around, and your organs aren't used to being fondled and moved and that kind of thing. So she did say that sometimes it causes your liver to be inflamed a little bit, and that can take some time to go away. So that did make me feel better, because I asked her about my blood work initially when they did like a full panel of blood work. She said my liver enzymes weren't elevated, so she said it's probably nothing to be concerned about, but we'll just keep an eye on it. So I am so grateful for the doctors and nurses and nurse practitioners at Hotel Dieu. They take their bariatric patients very seriously, and they monitor them very closely. If you have any issues, you can always call and talk to one of them. So that's what I like about them, is that they're a phone call away. Like your family doctor is great too, but trying to get into your family doctor, it's like, well, you know, they can see you next week. Whereas if I have a concern, I can just call the bariatric clinic and just speak to one of the nurse practitioners, and they can just put your mind at ease. So that is one thing that I'm really grateful to be a part of the bariatric clinic, because they're really, really, really good. Anywho, I won't keep blabbing on. So hopefully that doesn't happen again with the abdominal pain, but I will keep you guys updated. So if you want to subscribe to my channel and watch for my next video.